Life is good, precious, and exciting. But the question is, why would an individual who looked good, excited about life, could suddenly slump and die? Why would a person suddenly slump and die? This is a question many people ask. If that is one question you sometimes ask, then this video is for you and every adult in your world. According to the World Health Organization, cardiovascular diseases, ischemic heart disease is the leading cause of death globally. This accounts for mortality all over the world, and it is also a common cause of morbidity. So in this video, I'll be talking about the different factors that can make an individual to slump and die. Interestingly, some of these causes of a slump and death in individuals are common yet overlooked. Even though a heart attack may be a cause of an individual slumping and dying, it is not the only cause of slumping and death. In this video, my intention is to help you see, identify, and put yourself in such a position as to prevent these different causes around you, or help somebody around you to be well informed about these different factors and to prevent them. Many of the causes of slump and death are actually common yet overlooked, but in this video I am providing you with different factors that can make a person slump and die. So a knowledge of this would help you to prevent this from happening to you. You also need to share this information with somebody around you so that they can also learn and be able to prevent such from happening to them. So these factors are actually preventable. I have categorized them into 4. First of all, let's talk about physical health factors. A number of physical factors can make a person to slump and die, beginning with dehydration. That is low or inadequate fluid levels in the body. When an individual lacks adequate water in their body, there is a tendency to become weak and fatigue, and this can lead to slumping and even death. So it is important to take adequate water through the day. As an adult, on the average, you should have at least 3 liters of water through 24 hours. Next point is hypoglycemia, that is low blood sugar in the blood. When an individual has a low blood sugar, this can result into dizziness, confusion, and a sudden loss of energy, which can lead to slumping and death. It is important to note that eating is an essential aspect of our lives, and it is important to eat adequately and eat healthy. That means you should ensure to have a balanced diet for your breakfast, for your lunch, and your dinner. Talking about balanced diet, you need to ensure vegetables and fruits, carbohydrates, protein, some fat. These are very important in ensuring the prevention of hypoglycemia. Some people actually have some medical conditions that can predispose them to hypoglycemia. For example, people that are diabetic. If you are a non-diabetic patient, you need to follow your doctor's advice on the management of this condition, and you should note when you begin to have symptoms of hypoglycemia, which will require some immediate attention for you to prevent the risk of slumping and death. Next is deficiency in some nutrients and minerals. For example, deficiency in vitamin B12 levels can lead to fatigue and sudden slump and death. Now let's talk about medical conditions. As I mentioned earlier, according to the World Health Organization, cardiovascular diseases, ischemic heart diseases are the leading cause of death globally. Some medical conditions like hypertension that can predispose a person to a heart attack, myocardial infarction leading to a cardiac arrest, or even a stroke. A stroke can make a person to slump and die. Cardiovascular disease, talking about a sudden stoppage in the activity of the heart, which can stop oxygen delivery to the different tissues in the body, and this can lead to slumping and death. Talking about stroke events could either be a bleeding into the brain or a blood clot in the brain. When this happens, it deprives the brain of the oxygen supply and the necessary activities, and this can lead to sudden death. According to statistics, about 12.2 million stroke events occur globally, and in these 6.5 million deaths occur yearly. So it is important to have some preventive measures to avoid developing these medical conditions such as hypertension, diabetes, and the eventual complication of a stroke. So you can check out some of the videos I have done on hypertension, diabetes, causes, management, and even prevention of these medical conditions. On the physical health factors that may predispose or cause a person to slump and die is physical exertion. Excessive physical activities without rest and over-exertion and lack of sleep are major factors when it comes to a person getting fatigue and experiencing a slump and even death. The individual may just become tired and lose energy and may fall, and this may lead to death. Now let's talk about environmental health factors that may cause a person to slump and die. 1. Poor air quality may make a person to slump and die. When a room or an environment is stuffy, polluted, and poorly ventilated, can lead to lethargy and make an individual to slump and die. Next is extremes of temperature. Have you ever been in a room that there is poor ventilation and heat generation in that environment or in that room becomes so high that you become so sweaty, the room is so stuffy and looks like you are feeling dizzy? Then that is an environment you need to change immediately. So extremes of temperature like cold or excessive heat can make a person slump and die, and this is common even in the elderly. Hey there, do you know that psychological health factors may also cause a person to slump and die? Yes, conditions such as depression, anxiety can make a person to lose energy, become fatigued, and may cause them to slump and die. So it is important to be able to identify these mental health conditions in individuals around us, even in yourself. When you begin to notice that you're getting too worried, you're getting to avoid eating, you are losing energy, then you should present to your doctor for proper evaluation and management. And at such a time, you may benefit from receiving support. And if you identify someone around you that is withdrawing to self, worried, complaining about frequent headaches, lack of appetite, this may be some symptoms to show that they need some professional evaluation and support. Still under the psychological health factors, we must definitely talk about the stress factor. Any disturbance in your normal physiology, in your normal activities as an individual is stress, and the factors can be from different things. Maybe due to the work environment, it may be working in a toxic work environment, it may even be due to toxic relationships, and this can lead to lack of energy, loss of interest, fatigue, and can make a person even to lose appetite, and then they may experience a slump and even death. Have you seen someone or heard about an individual slumping at work? Sometimes prolonged stress can actually lead to burnout. Burnout is one psychological health factor that can make a person to slump and die. So it is important to learn to take breaks in between work. So maximize this period of break, and employers should make this an important aspect of their employees' healthcare pattern. So as an individual, you must also learn to take breaks in between your work and even other activities that may actually be legitimate and require your attention, but learn to take breaks so that you can refresh and be more energized to continue. Finally, let's talk about lifestyle factors which can also lead to slump and death. Now, lack of exercise may make a person to become weak, fatigue, while physical activities, regular physical activities, can help to maintain energy levels and help to prevent slump and death. In getting involved in exercise, you need to have proper evaluation. There's something that we call exercise prescription, which you can receive from your doctor, which involves assessing your health status and the type of exercises that may be appropriate for you. So it is important to consult with your doctor on this. Next is diet. What we take in is important to determine how we feel and how active or inactive we are. So diet that is balanced, involving regular intake of vegetables and fruits, about 50% of your plate, while 25% as carbohydrates, protein 25%, and fat in between there. Though this list that I have provided in this video is not exhaustive, if you know other causes of slump and death, you can drop in the comment box. If you have any experience you want to share with us, kindly drop in the comment box. If you have questions and need for clarifications, I'll be willing to answer your questions in the comment box. So drop a comment, let me know what you think about these different causes of slumps and deaths. I believe that you've been able to get some important information on causes of slumps and death. I want to encourage you to take note of this point and to put in measures as much as possible to prevent experiencing conditions that may predispose you to experiencing a slump. And if you have been having frequent slumps, it is an invitation to see your healthcare provider. It's important to see your doctor so that you can get appropriate evaluation to prevent slumps that can lead to death. Thank you for watching. I want you to kindly subscribe to this channel and click on the notification bell so that you can get regular, vital, and updated information on this topic and many other health related topics.